The coronavirus mainly affects the lungs and gains access to it via the nose and mouth while breathing. One of the entry points that hasn't been talked about as much is the eye. The eyes are connected to the nose and mouth via the nasolacrimal duct. And that makes sense. You might have used an eye drop and felt the bitter taste of it soon after. This is why COVID guidelines insist on not touching the eyes after touching a surface that may have been contaminated. But there's another way the virus can make its way into the eye: droplets. Let's say someone is talking near you who isn't wearing a mask. They can shoot virus laden respiratory droplets towards your eyes. The risk of this kind of transmission would be quite low if everyone were to follow COVID guidelines diligently. The mask of an infected person will not let exhaled droplets reach you. But because we encounter people who don't wear a mask or wear it improperly, eye protection is absolutely essential. In 2020, a study was conducted that monitored infection rates among community health workers in Chennai. Initially, they were wearing a PPE kit minus the face shield. 19% of workers developed an infection within a period of about 2 weeks. Face shields were then introduced as part of their PPE kit, and after this, none of the workers developed an infection in the subsequent 40-day period, despite having been in close proximity to COVID positive patients. It may be worth noting that the caseload in Chennai was higher in the latter time period. Also, according to CDC's advisory, eye protection is recommended for use by healthcare workers in places where community transmission has taken hold. 2 weeks ago, a YouTube video was released on CDC's official channel that also supports the use of eye protection by means of face shields or goggles. The eyes, in addition to giving the virus access to the lungs, can also provide a breeding ground to the virus. The virus invades cells by attaching itself to ACE2 receptors, something that is found in plenty in the lungs. The surface of the eye also has these receptors, which the virus can then attach to and later multiply. That explains why conjunctivitis is observed as one of the symptoms of COVID 19. Most of these studies emphasize the need for eye protection in healthcare settings because of higher exposure. In the second wave, the exposure in community settings is also quite high, as India is recording a test positivity ratio of 20%. Therefore, eye protection should be adopted in community settings as well. Face shields provide the maximum protection but can be quite heavy for use over long durations. You can use swimming goggles if you have that, or if you prefer normal goggles, buy the ones that provide protection from the sides, the top, and the bottom as well. If you wear specs, a face shield would be the best option for you. I should mention that these measures must be taken in addition to proper masking. A face shield alone will not prevent you from breathing in infectious aerosols or droplets. I have provided the links of the resources that I've referred to. Because precautions are the only thing in our hands right now, we must do whatever we can to cut the risk of infection to the best of our ability. And as mentioned in one of the articles, eye protection might just be the missing key, one that is often underappreciated.